According to the World Health Organization, people ill with COVID-19 and tuberculosis show similar symptoms such as cough, fever, and difficulty breathing. Both diseases affect primarily the lungs, and although both biological agents are transmitted through close contact, the incubation period from exposure to disease in tuberculosis is longer. It is anticipated that people co-infected by COVID-19 and tuberculosis may have poorer treatment outcomes, especially if the tuberculosis treatment is interrupted. The Georgetown Public Hospital Chest Clinic conducts thousands of tests for tuberculosis annually. Nightly News, during a tour of the laboratory, was informed that the use of the Gene Expert machine allows for timely diagnosis to be made following the collection of samples. Jamal Duncan, a medical officer attached to the Chest Clinic, gave insight into some of the safety measures adopted at the facility to reduce the spread of COVID-19.
With the fact that we have the COVID-19, we're trying to remove that. So what we do daily, we would call the patients because we have what we call DOTS workers, field supervisors, who are in charge to certain areas and certain amount of patients. So these individuals would call these individuals every day to see how they're doing and make sure that they're taking their treatment. But we would give them at least 2 weeks treatment at a time. Afterwards, they would return to clinic and we would follow them up. If during the time that they're away from the hospital, we find that there's some symptoms, we have drivers that we will go directly to these patients' houses and we're able to see them, and either if they need to be admitted, we will take them for that. Anybody that's coming to the program that needs to receive treatment, that are coming for the first time, that have symptoms, we will see them at the gate first.
Upon entering the compound, persons are questioned on whether or not they are experiencing symptoms of either of the two diseases. Based on their responses, they're either sent to the COVID-19 screening area or further examined by health personnel of the Chest Clinic. Duncan reiterated the importance of social distancing and respiratory etiquette as the local health sector wrestles the burden of COVID-19.
Imploring both our patients and the general public that during this time where we have the COVID-19, that we should try to practice the best preventative measures possible. Let's maintain social distancing, practice good cough etiquette and respiratory etiquette, meaning that if you're coughing, please do not use your hands. You can use your sleeve of your shirt, and you can also use tissue and so on. Also, we endorse washing hands because this is one of the main means that they have for us to control this virus.
According to Dr. Jitendra Mohanlal, manager of the National Tuberculosis Program, Guyana recorded some 437 new cases of tuberculosis in 2019. In 49 of those cases, the patients in remission relapsed. Temika Rodney reporting for HGP Nightly News.